This video will show you the light curing technique using an educational tool. We're going to need a light curing unit, 2 protective blue light blockers or orange goggles, alcohol swab, and a protective shield for the light curing unit. A patient simulator will be used to practice the light curing technique. The patient simulator consists of a phantom head and a laptop. The laptop will show you your technique in real time, shown in a graph. You have to check the light guide tip that it's clean before and after curing. If there is any remnants on the surface, you have to clean it using alcohol swab, and there is a separate video showing you how to do that. For this video, we're not going to put the protective shield. Both the dentist and the patient must protect their eyes using the orange goggles. The patient simulator consists of 2 sensors, an anterior sensor and a posterior sensor. First, we're going to show you the technique using the anterior sensor. The anterior sensor is placed between the central incisors and it's 1 mm recessed below the surface. You place the light guide tip perpendicular to the surface as close as possible without touching the surface. Place finger support, and then you light cure according to the manufacturer instructions for the composite you are using. During curing, you have to keep your eye on the filling. This is a side view showing you the curing technique. Similarly, you're going to place the light guide tip perpendicular to the surface being cured as close as possible without touching the surface with finger support, and then you light cure according to the manufacturer instructions. You have to keep your eye on the filling when you are curing. That is why we're wearing the protective eyeglasses. You have to keep your eye on the filling. That is why we are wearing the orange protective goggles. Going to the posterior sensor, you're going to use a similar technique. The posterior sensor is placed on tooth number 27, where the sensor is placed 4 mm recessed below the surface. You're going to place the light guide tip perpendicular to the surface as close as possible without touching the tooth with finger support, and then you light cure.